good? You ready?
Yes.
Awesome.
She's a familiar voice on infectious diseases, but this time we're talking about measles with state epidemiologist Dr. Rachel Herlihy.
Remind us how measles spreads. It can be in the air for a while after someone leaves an area, right? And it's very infectious.
9 out of 10 susceptible people, so people who don't have immunity to the virus that come in contact with someone with the infection are going to go on to develop the infectious disease. So very, very infectious.
Measles incubates longer in the body, which makes tracking exposures tricky.
We try and identify all of the known contacts first, right? So these are going to be, household contacts, close friends, healthcare providers, people that had very direct contact with that person. It can be really challenging for cases to remember everywhere they've been while they were infectious. Keep in mind that the incubation period, so the time from exposure to onset of illness for measles, is typically anywhere from 7 to 21 days.
But some of these have been like grocery stores, and there's no physical, there's a limitation there. You can't call every single person because you don't know who all shopped at a Trader Joe's on this one date.
And we work with businesses and healthcare facilities to really try and find all of those people who may have been in the same place at the same time. And that's really when we rely on our press releases and the media to notify the public of places where cases have been, these public spaces where we really can't identify all individuals.
Most of Colorado's cases stem from international travel or exposure to one passenger on a Turkish Airlines flight that landed at DIA. And some of those who got sick were vaccinated.
Most adults are walking around vaccinated for measles, but we're seeing some breakthrough cases. Breakthrough cases are still considered not normal, that's kind of unusual, but we're seeing it happen.
In rare cases, someone who was vaccinated and even develops an immune response to the vaccine might still get measles if they have this intense or prolonged exposure to the virus. We believe that person was incredibly infectious, and then when you think about the length of a flight, international flight, there's certainly a prolonged period of exposure.
What do we know about those cases as far as how severe people who get sick being vaccinated? Is it a lesser symptom?
That is the great news, in that when these breakthrough cases occur, they usually result in milder illness and infections that are less likely to be spread to others.